Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I got a great one for you today. It is all about cost of care, pricing in veterinary medicine, what the options are to keep care affordable for pet owners. This is a really good conversation that I really enjoyed and I sat with for quite a long time. This is with my good friend, Dr. Emily Tincher. For those who don't know her, she is the Senior Director of Pet Health at Nationwide, and she is a deep thinker on the spectrum of care. She's got a lot of good insight. I always enjoy kicking things around with her. We don't always agree. I think today we're pretty much in alignment. We might have gone back and forth about a couple of points, but anyway, I always take away fresh ideas from my conversations with her. She is really sharp. This is a great episode. I'm so glad to have her here. Let's get into it. And let me just say, this episode is made possible by our friends at Nationwide. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Emily Tincher. How are you?
I'm doing great. Thanks so much for having me back on. Excited to see you and chat about some interesting topics.
I love having you on. I love having you on for a number of reasons. Number one, you and I have known each other since veterinary school, and we were business nerds together in vet school. And then two, you are one of the most polished, elegant speakers that I get to work with. I aspire to present.
Just setting me up to fail here. I see what
I know. I really absolutely fluffing you up.
Very kind nonsense to say. I very much appreciate it. I have loved watching and learning from you speak with the energy and ability to connect to audiences. I really love watching people that I admire and learning from that. So that's a very kind thing to say.
You are amazing. You have got a lot of stuff going on, my friend. You are doing a lot of stuff. I've had you on the podcast a number of times to talk about different aspects of spectrum of care and keeping care accessible and cost of care and things like that. Mm-hmm. You have got a new book chapter that is out, is in a book called Veterinary Clinics of North America, Small Animal Practice. Your chapter is with our mutual friend, Dr. Jules Benson. The chapter is called Cost of Care, Access to Care, and Payment Options in Veterinary Practice. And you told me the chapter was edited by our other friend, Dr. Peter Weinstein. It's like this meeting of the minds. That's amazing. Let's go ahead and start to talk about this. One of the points that you make in the chapter that I've thought a lot about over time is you make the comparison of vet prices to overall inflation. Like the price of living is going up, at least in the States. Mm-hmm. And to me, that's very clear at the grocery store. Like for a while, every time I went to the grocery store, it cost significantly more than it had cost before. And so life is just getting more expensive to live day in and day out. And obviously the cost of veterinary care are going up as well. But you point to data that shows our price increases are not in line with inflation overall. Why don't we just start there and you can kind of start to unpack that for me?
Yeah. And just first, a huge thank you to Dr. Peter Weinstein for inviting Jules and I to co-author this book chapter together. It was an experience. It was our first book chapter to write. It was enjoyable, but also challenging. But I appreciate getting to collaborate with Jules on a number of things. So just a thank you to both of them for the chance to do that and the collaboration. And it was a great opportunity. The part that to start with is how are costs changing? And I think why should we care about that primarily? What effect does that have on the pet families that we serve every day? And by extension, how does that change our conversations or the emotions that we may be feeling in those conversations? And so we think about just looking at the consumer price index. So from the U.S. Bureau of Labor Statistics, over a 20-year time period, all goods inflation rate has gone up 61% less than the veterinary services bucket that they measure as one of those components of the all goods. And so that says over that 20-year time period, our pure inflation, so just the cost of doing the same thing, pet families are experiencing that compared to, buy a dozen eggs at the store, when they come to see us for a wellness exam and some vaccines, that they're seeing a significant difference simply in the cost before we start to look at what is the care that's actually being provided. I think I really felt this on a personal level recently. I got a puppy. His name is Sprout. He's really cute. And I'm really spoiled. So I being the daughter of 2 veterinarians, I didn't know for a long time on that personal level what it was like to pay for my own veterinary care.
Yeah.
Until I was adult. While I saw them deliver estimates all the time, I wasn't personally doing it, but they were my veterinarians for a very long time. Taking Sprout in for a wellness exam, a round of vaccines, a fecal, and a microchip was in a awesome practice. I had a fantastic experience, no complaints. So hear me when I say I don't begrudge this at all, but it was about $400. And when I think back to growing up, what that looked like in a a different environment, mixed animal practice in rural Kentucky versus here in Colorado, that was it just probably closer to $150 maximum. So that change is in just the cost component is one that sometimes can feel shocking to pet families especially if they've had pets long term, not understanding why they're seeing the changes that they are.
Yeah. Oh, I think you're spot on. I think whenever we start to have real conversations about pricing and medicine, we have to insert some nuance, right? Mm-hmm. The worst thing in these conversations is people go to extremes, or we don't allow people inside of our own profession to say, hey, we are quote unquote worth the money that we're asking for. Mm-hmm. And also your average American doesn't have $1,000 in savings. Full stop. And it can be hard for them. And I think a lot of times people want you to pick a side. You're either your team pet owner who doesn't think this is fair and people are jerks, or your team vet med, which is people should see our value and happily write us checks for what we ask for. And neither of those things is really realistic. The truth is in the middle. I want to ask you a little bit about sort of public perception and kind of where you see it as. I've seen there's been a number of sort of flare-ups recently on the social medias, which I try to stay away from, but I'm not completely removed from. There's the most recent one I saw. There's this guy, and he's got blood work, and he's ranting about how veterinary clinics will double the cost of blood work that goes to the lab. Can you believe this? What a scam! And of course, there was a huge reaction, of course, from the vets, because they're like, first of all, that's ridiculous. That's like criticizing lawyers for marking up the paper that they write on. It's like, I'm sorry, I have no idea what the carpenter paid for his hammer, but that's not what you're paying for now. But there's a big reaction around that. And so I look at that, and sometimes it feels like there's this big debate and vets are charging way too much and blah, blah, blah. But I also know that, the 4 drivers of engagement on social media are negativity, emotional and moral language, tribalism, and extremism. Those are the 4 drivers. Yeah. And so I know that message
usually a meeting of having meaningful conversation and trying to meet in the middle, right?
Exactly. And so I don't think that what I'm seeing online is an accurate reflection of probably how your average pet owner perceives our prices. What are your thoughts on that, Emily? Do you think that the average pet owner is do they have a strong emotional reaction? Do they notice that prices are creeping up? We see with the VHMA surveys that come out, which are excellent. We sort of talk about, year over year, we see the number of visits go down, but profitability stay or go up because we're raising prices. But I don't really see accurate reporting of how pet owners perceive this trend in our industry. What are your thoughts?
Well, we're raising prices, but then we're also the number of goods being added to each invoice. So the number of light item details are also increasing. So those components of simple cost increases, but also some of the other drivers of increasing cost of care is advancing level of treatments too. And we can maybe talk more in detail about that. But I think it's a really interesting question that we don't know the answer to that much. I think I would advocate that what pet families do we understand the best in veterinary medicine? The ones who see us, right? The ones that come in, we have the best understanding about them because we see them in an exam room setting. They're often the ones that are included in market research. And those who are already accessing veterinary care are the ones that we know the most about, but we're not necessarily asking them how they feel about price sensitivity. We are seeing trends, to your point, from VetSource. There are other references, but I like the VetSource AVMA weekly free report that comes out via email if you like it. That shows us, to your point, visits are down, but average client transaction revenue is up. So we tend to mostly talk to those who come in to see us, but we don't ask them necessarily, maybe when they're not feeling that emotional component of having just received their invoice. I will say there's a communications component to that we sometimes do really well at, and sometimes probably could have some room for improvement on. When we have asked as a profession, veterinary, asked pet families, how do you want to be communicated to around money? One of the big no-nos we've discovered is that it shouldn't be a surprise when the pet family goes to pay for their bill, how much they're going to be paying. And I can tell you that I have had recent, in multiple different places, experiences with my horse, who's lame right now, unfortunately, experiences with my new puppy, and a couple months ago, some experiences with my cat for some monitoring blood work that for just keeping track of HCM that his two brothers have. None of those cases, and maybe they're interacting with me differently because I am a veterinarian, but in none of those cases, and we do have some data available to us that still pretty frequently it's a surprise to people. Yeah. So that's one level up that we could all do, is to help make sure that we're informing pet families what the costs associated with care are, and then have that opportunity to discuss the value associated with that. Bring those two things together. But we don't do a good job. I put that on all of us, of like, we don't do a good job of asking pet families what truly they're looking for, how they're perceiving the changes in cost and the changes in care, what they want. And we also don't do a good job of talking to pet families that are not routinely coming in to see us for veterinary care, to ask why. What is that we're not fulfilling for you? Is it primarily financial? There's some evidence from the Access to Care Coalition that financial barriers are a big one.
Yeah.
But what are the other barriers, and how could we potentially make sure that you have the health literacy conversation about why it's important, but also the different potential methods of increasing access to care that might come from that conversation.
Yeah. It's survivor bias. When we talk about who we're talking to, it's the classic example of like when the military would look at planes that came back from combat, and then they would look at where the bullet holes were in the planes, and they were like, oh, we have to put more armor here. And then finally someone pointed out, we're looking at the planes that come back. We need to look at the planes that don't come back and see where they got hit, because that's where we need more armor. And the same thing is here too, is like we talk to the people who come back and try to adjust to their desires, but we're not talking to the people who didn't come back, who have a significant complaint or perspective and something like that. I think that's true. I really like your point about surprises. I think people are innately good, but I also think that we like to be comfortable. And I think that if you said to me, Andy, would you like to go and let this person know that they're going to spend $675 for their 2 labs today? Or would you just like to let the front desk do that? I'd be like, well, it's just about me. Then I would like to let the front desk do that. But that's the outcome is not positive. And I think that's why we have such huge turnover at the front desk, is tasks like that of surprising people with bills.
That and potentially pay discrepancies for how challenging that role really can be.
Yeah.
I mean, there's great evidence, peer-reviewed evidence, that involving the entire healthcare team, from veterinarians, receptionists, to our licensed technicians, all the way through, all being on the same page about costs and discussing them, is really important for buy-in from the client. So there are reasons to do that, to have that training and conversation with the team. I do want to briefly mention, because we brought up as a problem, not addressing and talking to pet families and asking them what they want. That is something that we tried to do at Nationwide with a research study that will hopefully be published later this year. We've been talking about for the last couple of years to ask what are the preferences that you have surrounding. And we didn't necessarily do a straight survey, because we know that there's a lot of emotional bias for pet families. Mm-hmm. Asking what are the motivators? And we've talked about this before on a podcast, but I think it's worth just briefly mentioning again that we identified, relatively independent of demographics, that their motivators are cost, choice, and convenience. And that those different groups of people want to be talked to differently in relation to their preference for how they're going to choose the care that they choose. So we're trying to help solve that challenge that we've identified, but I do think it's a larger one industry-wide that we can continue to ask pet families and involve them in the conversation for how care is evolving and how delivery of healthcare is evolving, so that we have that kind of service and product market fit.
I've thought about that since we first discussed it. I have found it helpful to look at pet owners from time to time and just kind of ask myself, is this a cost-based client? Is this a convenience-based client? Is this a choice and understanding education-based client? I think that that's an interesting way to kind of parse people apart. Again, it's never perfect and it's always a mixture of things, but,
Totally.
but it definitely helps to it's helped me get my head around it. I want to jump back real quick. We were talking about rising costs of pet care. You know, you've talked before about sort of three. I'm curious how much weight you put on these. Obviously, there's a lot of reasons for the cost of care to be going up, but you want to kind of call out specifically staffing costs, adapting to changing practice economics, and then increased costs of consumables and drugs as kind of your big three. Do you see those as the primary drivers, or are they three that you think kind of slip under the radar?
I think they're three of the main drivers. To your point, we could continue to, and veterinary economists have delved into further areas, but I think three of the big drivers that we're seeing recently, and as we wrote about in the book chapter, three big changes, and maybe they're constants, and these things seem to be maybe accelerating right now, are contributing to that feeling we all have of costs seem to be rising quickly right now. So staffing costs, I think, is a really interesting one. It's really important and needed. We have needed to increase salaries, not just for veterinarians, but for more so, frankly, for our support staff for a long time. We still have some room to grow there, potentially considering different incentive methods. What does it look like for there to be different methods of compensation that involve the whole healthcare team having a production type incentive? There are things to be considered that are outside of my realm of expertise, but what we did talk about in the book chapter is the staffing costs of rising salaries that we need to recruit and retain the people to do the work in a practice, in a clinical setting. There's nothing bad about that. That has been needed. However, it's important to remember that there are also results that come from that. And pet families are kind of helping to carry that greater financial burden because we have to accordingly raise prices to help pay for those staffing costs. So it's not a bad thing that we're doing that. It's a good thing, but it's also something to know. That's one of the drivers, that the ultimate feeling of that is being seen in invoices, being in care plans being discussed.
When you talk about adapting to changing practice economies, the way I took that, and I want to see if I'm right here. To me, these are this sort of the changing of the landscape that we're facing. So, for example, if a practice started to have less pharmacy business because of online pharmacies that their clients were using or things like that, that would be sort of a changing economy. If they were introducing new services, they're doing their own ultrasound scans, or they're shifting around doctor schedules to offer telemedicine or sort of things like that. Those are all different ways of working that are being offered as services to the pet owners, but they are affecting how we price our services and what people are sort of leaving the clinic having paid. Is that correct?
It is. I think that if we just look at examination fees, for example, I think exam fees is something that we've seen change relatively significantly in many practices over the since COVID. And essentially we see less production coming from pharmacy. A trend that we are seeing across vet med is rising exam fees to go along with it. Now, not saying causation or that's purposeful in every case, but it is one that you'll hear consultants talk about, for example, as increasing your exam revenue to kind of make up for that. Again, there's nothing inherently bad about doing that. Ultimately, what are the things that we as veterinarians and veterinary healthcare teams can exclusively do? In this case, we're talking about an in-person setting. And that's use our brains and have services. The pharmacy stuff, it is an opportunity for pet families to save some money in one area, if that's, potentially ordering online or going to a Walmart for a prescription.
Talk to me a little bit about your idea that we're seeing a decrease in access to intermediate care. I think that that's an interesting idea. Can you sort of lay out what you mean when you sort of put that forward?
Yeah. So as we consider the concept of a spectrum of care, what is something that most of us can do in clinical practice to increase access to care? We can provide options, and they have to be specific to the setting that we're in, but we can provide a range of options. And, at the high end of that, if we consider, we recently, in April, we released our annual most common claims at Nationwide. We can attach that in the show notes, the press release from that. For, I don't know, many years running straight, for dogs, the most common claim yet again is skin allergies and skin infections related to skin allergies. It's top 10 for cats as well, but not the number one spot. So why don't we think about it that way? For a skin allergy case, the most advanced level of care may be, especially for a case that's more chronic, as they tend to become, maybe to go see a dermatologist. That is an option. Pet families should know that it exists. In this case, there's a lot that we can do and do frequently on a day-to-day basis as general practitioners for treating skin allergies where we are. That is pretty different when we think about some of the surgical things that are out there. I think from a skill set perspective, and one, just going back to the skin allergies, it's more common than it used to be to refer to see that dermatologist. There's a lot more access to referral care than there was even 10 years ago, much less 20 years ago or beyond. And so, again, that's a good thing. And at the same time, having more referral, that increased level and access of care, we're sometimes managing less in-house, sometimes more likely to refer, which is a great fit for some families and not as good of a fit for others. From a true skill set perspective, sometimes I think we end up talking about surgery a lot. And whether it's a combination of so many factors, much like the cost of care and rising and the why for having less experience or less of a skill set in general practice settings to perform intermediate level surgeries, whether that's, a lateral suture for a cruciate ligament or a perineal urethrostomy for cats. So even foreign body surgery, many of our, especially younger veterinarians are not comfortable performing that surgery because of the mixture of, I think, fear sometimes of learning that skill set after we graduate, and there's a lot less surgery experience while you're a student than maybe there used to be. There's just the less of a mentorship culture and ability to continue building that skill set, especially comfortably, than we used to have, resulting in, some folks simply cannot go. They could afford to pursue surgery with us in a general practice setting, but that's not always going to be the case, and certainly hasn't been when I'm providing estimates at an emergency specialty hospital. Not always the case that that's an option to move forward in a specialty referral environment.
I completely buy that. I was intrigued when you said that. I've got this idea, Emily, that part of sort of the path forward, as we let our support staff work at the top of their licenses, I think that we can continue to pay them better and let them have more autonomy. And I think that general practice veterinarians are going to have to move up more towards the top of our licenses, which means I think we can see a lot more of our basic wellness services being handled by our technicians, or I don't know if a mid-level practitioner will appear or not. And I'm not trying to stoke that. But if that were to happen, I could see a lot of basic service being provided by those people. And then what would happen is general practitioners would move up more towards a management role of providers. And then also that intermediate level care. But I really do think, and I know I'm a perpetual optimist, I really do think that there's so much fertile land there for us to cultivate. There's just so much opportunity for us to start retaining cases that we're punting that maybe we don't need to. I think surgery is a great area for that. But we've got to get some mentorship and some growth and educational pathways so that people feel comfortable getting there. But I completely agree. Even when I started in vet school, 15 years ago, more than that, there was a lot of stuff that we did in practice that I just don't see being done that much anymore. It goes to the specialty hospital, and again, it's not bad, but it has cost ramifications.
the other, the way forward may not be the way backwards sometimes. And so one of the other interesting things that I'm seeing, and you have to have a certain population density probably for something like this, but there are now some general practice level surgery only practices cropping up. And so I think that's a great example of what are the new ways of modeling practices that may more suit our current environment. So how could you efficiently have dental only practices, have general practice level surgery only practices, if doing that in the general practice setting of my parents, in the way that I grew up may not be the path for everyone? Could it be that you were working more within a community setting of, I cannot do surgery. I don't. It's been a long time since I've done a spay, much less at this point, it's limited to laceration repairs when I still pick up ER shifts sometimes. And I think like having an option like that to say, like, there's a practice nearby that during working hours, it's not a specialist and the costs are, some of them transparently, like sitting on the website. Exactly. This is what the cost is if you come in to see us. I think it's a really cool way forward, creative and innovative way forward for evolving some of our models. If you're not one that says our general practice is going to be mid-level surgery capable.
Yeah, I completely agree. I think the future of vet medicine is fragmentation. I think that's great. My biggest piece of career advice for people for a long time has been figure out what you enjoy doing and what you're good at, and figure out how to do more of it. And I think there's so many more opportunities to do that. When you say like a dental only practice, some people would just cringe away, and some people's eyes light up of like, oh, that would be, if I could just do teeth all day, like that would be amazing. I don't know. I see that with just such an optimistic lens of like, this is going to be great. I think charting your own course is something we're going to be able to do in ways we haven't done before. Talk to me a little bit more. So we're talking about sort of how do we, given that we have these drivers upwards of pricing, and we talked about, staff wages and things. I don't think that those are bad things. And I think that we agree, and again, offering people a higher level of care, that's not bad or innately bad in any way, shape, or form. I really don't think that people are, I don't know that we get treated fairly sometimes, especially by angry people online, but I don't think anyone's the bad guy here. At the same time, going back to our nuanced approach from the very beginning, it's challenging for people to have pets if they have limited resources. And I think that a lot of us, it's funny, we'll get fired up and say, well, we deserve this money, or we're worth this, or this is why the price is what it is. And then if you say to that same person, well, do you think that people who can't afford that shouldn't have pets? And they're going to go, no, I don't want that to be reality. And so how do we start to find the middle ground, Emily? Like, what does that path look like?
I think the question that you almost touched on there is like, is our pets a privilege? And
I almost asked that question, and then I backed away from it.
Well, it's an important one to talk about. I see it sometimes, and I think when in our hardest moments, in our most challenging days, that it can be tempting to say, if you don't have the financial planning to fix the foreign body, then you shouldn't be able to own a pet. But the reality is that 60% of Americans live paycheck to paycheck, and most Americans would struggle to come up with more than $400 for an emergent situation. And so if we're going to say that most Americans should not have a pet, I think we have to step back and say, first of all, the human-animal bond is so incredible for the value it provides to us as humans, for mental and physical health, development of children. That's not, we have to back away from that. That is, we cannot understand the value of the human-animal bond and at the same time believe that pets are a privilege that only the wealthy should have available to them. And we have to acknowledge that no one's asking us for our permission. And so,
yes. That's a good point. Like people are like, let's see what the vets say about whether or not we should have a pet. Like, that's not happening.
It was, I don't remember who said it. It was a comment at the American Association of Veterinary Medical Colleges a couple of years ago. Just kind of stood up in a spectrum of care forum and mentioned that. And I that's really stuck with me of like, no one's asking us for for our permission to add a pet to the family. And so even coming back to a One Health perspective, then we have to find some way to work together with pet families to prevent zoonosis minimally, but then also to the level up from that is to protect and promote the human-animal bond. And so I don't believe that pets are a privilege. I think, that we do have to provide them a level of, at least a basic level of care. And how do we engage with that? How do we as vet healthcare teams say, what can I do on an individual level, maybe a community level? And I think spectrum of care is a great one of the solutions, but increasing access to care requires all of us to work together. And it requires a lot of different solutions layered over each other. Financial planning resources are, I think, another really important one to both help pet families say yes to the care that we're recommending, even as we come back to that idea of advanced level care and what is the right care. And I'm having a lot of really good conversations with how do we define best care?
Yeah. I agree with that.
Maybe define it as like the most advanced level or the gold standard, a term that I'm desperately trying to avoid, except calling out that it's not very helpful. The best care, in my opinion, is the care that meets pet family needs. So the pet gets what they need, but also acknowledges some of the resource and budget constraints that we've talked about, why those are popping up today.
Yeah, I think for me, because I've thought about this as well. So for me, defining best care, it's still a little bit nebulous in my mind, but basically three requirements are for me. Best care has to get done. It's not best care if it doesn't get done, because then it's no care. And so best care has to get done. It should be care that the pet owner feels good about, like they feel good about what they provided, and it should be care that the practitioner feels good about as well. And I think if you have something that actually gets done and the pet owner feels good about it and the provider feels good about it, you're probably pretty close to best care. I don't know. Maybe that's too low a bar. I don't know. I have to keep working on it, but I think there's something there.
I think that it's really important to, we're applied scientists, and the amount of evidence-based medicine that we have, peer-reviewed medicine that we have is not as much as we might like. Having more opportunities to measure the outcomes of care will really help us move forward in feeling good about different levels of care that are available. Unfortunately, right now, there's not a lot of outcomes-based medicine, but there's more evidence that's available to support more advanced levels of care. I think there's some really great examples of a more intermediate level care being studied, especially through the ASPCA. We talked about some of those in the past. For example, in timing of that surgery, not requiring instant intervention or the pet will die. We can link that paper in the show notes too as well. I think it's a really important one. But know that we've touched just a little bit on advancing level of care. It's not a bad thing. And I think because when we're talking about increasing access to care, sometimes specialty or really advanced levels of care might feel like they're getting beaten up. Yeah. But I think that's because we already see the value in that. And it might be that it's very, very likely that in most cases, if we consider nothing else but the medical outcome, in most cases, probably the most advanced level of care would be the best option. But since that's not in line with resources that are available, and frankly, that's not always what people want, especially when we're considering chronic or end-of-life care, we have to consider some of those other options and bring them in.
Yeah. Emily, thank you so much for being here. Where can people find more information on spectrum of care? You've done so much with this. You've got so many resources, things like that. We're going to link up the resources you already mentioned, but where's your favorite place for people to go and learn more?
Yeah, there's a couple of places I would recommend. So we have nationwide put together spectrum-ofcare.com. That's some basic awareness, and we're adding some additional resources to that over the coming months. You can find me on webinars or writing often about, or at conferences, writing about spectrum of care. The other place that I would recommend, especially for some financial resources, would be to go to the Open Door Veterinary Collective, which is a nonprofit trying to kind of multifactorially look at how do we increase access to care, especially by rethinking a little bit. How do we consider the financial options that are available to us? Of course, pet insurance, work for Nationwide, a pet insurance company, is one of them. It's an important one, but we need a lot of other support methods to make a wide and lasting impact.
No, I agree. Thanks so much for being here, Emily. Thanks for tuning in, everybody. Take care of yourselves, gang. We'll talk to you later. And that's it. That's what I got for you guys. I hope you enjoyed it. I hope you got something out of it. Thanks to Emily for being here. Thanks to Nationwide for making this episode possible and sharing tons of resources in the show notes. Gang, take care. Be well. I will talk to you soon.